Well, hello there, everybody. Great to see you again, and welcome back to Calm in the Chair. I'm Ryan Ruff. I'm going to be your moderator for today's episode, and I'm sitting alongside Dr. Vince Monticciolo. We are so excited to welcome you guys back for another season of the show here. We've got a lot of exciting news to get to, and a lot of great episodes coming down the pipeline here with informative content and new services that Dr. Vince and his team are offering to the greater state of Florida and the respective area around his offices. Really excited to launch a new season of the show here. So before we get into all the fun stuff, let's go ahead and say hi to the man of the hour. Dr. Vince, great to see you today. How you doing?
Very well. Good to see you, Ryan. Welcome back.
Yeah, it's great to be back with you for another season. We've got some exciting news to drop with the audience today. Look, we're talking about the future of dentistry and how it's really arrived. We're going to talk about the new Dental Sedation Centers entity, and of course the sedation and surgery centers that you and your team are opening and working on. Let's start with that. Why build a surgery center? Dr. Vince, tell me about the inspiration behind this decision to open this dental sedation center in the first place.
Well, after practicing dentistry for now, more than 3 decades, it's really time for me to focus on really what inspires me, what my passion is, and what I think we're helping the most patients with. So, to be honest with you, I really enjoy. I've only been doing sedation dentistry with my patients exclusively for 5 years. I've been doing it for over 25 and been practicing totally for 36. But in my practice, I've kind of limited what I do to just dental sedation patients. So at this point, what we're doing is we get calls every day. Do you do children? Do you do some of these more advanced cases? We do a lot of the advanced cases, but we haven't done children. So in order to do children, we needed to add a dental anesthesiologist, we needed to add a pedodontist, and we needed to add some of the hospital-grade anesthesia machines and some of the safety features to our practices. The exciting part is we've taken from what was 12 offices and we've put dental sedation centers into 3 of our largest offices, so we can add the services, add the specialists, add the safety requirements that are needed for some of our tougher cases. So right now we're based out of Newport Richey, Seminole, Plant City, and we're building a 4th office now in Tampa on Dale Mabry. So these will all be large dental sedation centers with all the specialists.
Yeah, that's a tremendous advantage for those folks, and I would imagine there's probably a ripple effect, Dr. Vince, right, where going through sedation dentistry might change the overall experience for those patients that have avoided the dentist for years, and dare I say, maybe lead to some healthier habits because now they're not so scared about going back to the dentist and seeing you and your team. Am I correct in saying that?
For sure. The advantage is once we do sedate them once, they're kind of the family now because they see how nice it is. They have no recollection of the appointment. There's kind of an amnesic effect. They can sleep through their appointment if it's general anesthesia, and they can have their work done and wake up, and they don't know if it was 5 minutes or 5 hours. It's like a nap. You don't know how long you've been out, and so a lot of these patients now. We've been seeing them for numerous years because they won't go anywhere else. And even when they move away, they call and say, hey, we're coming into town just to see you. It's been a couple of years. We're coming in early in the week. We want to get our hair done by the end of the week.
I know you and your team, you pride yourself on creating that family atmosphere and so that people feel like they're coming home in a way anytime that they come back. One thing I want to flip over to, and in the expansion into the dental sedation centers, you had mentioned that you guys had expanded the team, bringing a dental anesthesiologist full time into the practice. Tell me how pivotal of a role that is and how rare it is for you guys to have someone with that level of expertise under your roof and part of the family that we're sitting here talking about.
There's very limited dental anesthesiologists in Florida, less than 10. We actually, today in our office, we normally have a dental anesthesiologist in our office 2 to 3 times a month where we do our advanced cases. But now we're bringing one in full time. So we're actually moving him in from the other side of the state, moving his family over here to Tampa. So we're excited for that. We'll have him there full time every day. So that is very rare. But we're hoping within a year to have a second one because my daughter's in a 3-year residency and graduates next year as a dental anesthesiologist, so she'll be coming home too. So we're hoping by the end of next year that we actually have 50% of the dental anesthesiologists working with our team in Florida. So it's going to be quite the operation. So we're able to treat quite a few of those people that need to see that level of care. So we do what we call moderate sedation, which is more like outpatient, kind of twilight, where they have no recollection. They can have their treatment done, but they're not intubated. With general anesthesia, we're breathing for the patient. They're hooked to the anesthesia machines, and it's a safer way to go, especially for children, especially for some of our special needs, some of our highly medically compromised patients. So we do see some transplant patients from the hospital that can't get on the transplant list or can't get their bone marrow transplant until all the infections out of their system. So those patients are actually, life or death cases, and we're able to sedate them, clean up all their mouth in 1 or 2 appointments, and then sign off that there is no infection. They can go in the hospital and get their treatment. So, that really can't be, we don't know any other dental offices that handle those kind of cases. So we're excited to do those cases. Today, we saw some pretty advanced cases with the dental anesthesiologists. And, it really is heartwarming to be able to treat these patients that haven't been treated in, numerous years. One of them, had some serious infection that we needed to get in.
Well, it's great to hear. And as we're kind of bringing our conversation to a head here today, obviously we're kicking off season 2 of the podcast. We're announcing the excitement surrounding Dental Sedation Centers. Final few questions for you. What excites you most about this next chapter? I mean, bigger team, better facilities, your daughter's getting ready to come home after graduating. I mean, it's an exciting time for the family, but what excites you most about this next chapter?
Yeah, it is exciting because it's a more focused passion project for me. Obviously, my family wants to know when I'm going to retire, and I said I'm just refiring, not retiring. I'm really excited about the next step. So it's given me a little spark again to move forward, and instead of having to juggle, a lot of plates in the air with the numerous offices that I have. We are focusing all our attention just on actually limiting our practice to just IV and general dental anesthesia. So that is quite a niche for us, but it's an exciting niche. So we can really focus on these patients, on giving them the care, the kindness, and the hope that they need. Because for these patients, it's so uplifting, to change a smile, to give them that self-image back, to, confidence back again, and, to really uplift some of these families. And it's really, especially with some of these cases, it's really about function and health. Some of our tougher cases that come out of facilities, or you mentioned nobody can get, or some of our combative patients, nobody can get in their mouth. So the infections, the bacteria, can cause pneumonia, can cause bad things. For us, once they're sedated and we can get them healthy and see them, once or twice a year and keep the function there and keep the health there, it's a win-win for everybody, So that's what I'm excited about. I really, my staff says you really light up around your sedation care, and now that's going to be a daily thing for all our patients. So for those that have been in our facilities, they know that they're already pretty large. So, 6,000 square feet up. So that's a lot of dental facility to handle our patients. So we have been tearing out some walls, tearing out some floors, cabinets to add the medical gas for the anesthesia machines and to add all the equipment that it comes with that and all the monitoring that comes with that. So we're excited for that part of it. And, to continue doing what we've been doing, but at a higher level. So we're really raising the floor on what we're doing. So it's a higher standard of care for these type of patients. So that's the exciting part. My staff's excited. You'll see some great changes at the office. So yeah, we're excited to bring everybody home.
Yeah, absolutely. And we're excited to obviously share all this fun news with you guys, our listeners and our viewers. As we wrap up here today, Dr. Vince, for anybody out there that's maybe, let's say, just jumping aboard the podcast and this is their first time tuning in and they're excited about what they're hearing with Dental Sedation Centers and would like to learn a little more, what's the best way somebody can look you and your team up, find you guys maybe online and learn a little more beyond the podcast?
Yeah, so obviously we've rebranded because we've added so many specialists, kind of taking my name off of it because it's more of a sedation specialty center. So the best way, dentalsedation.com. So we own the dental sedation domain. It's dentalsedation.com. Or if they want to call toll free, it's 833-5-SEDATE, 833-5-SEDATE. You can find us either way. Brand new website. We're excited for you to check it out. It's got quite a bit of exciting things there. You can kind of focus on what your situation is and hover over that, and then it'll give you a blow up, and you can learn more about that. So you can contact us directly through the website also at dentalsedation.com. You can leave us a note there, and we'll get right back to you. But the exciting thing is now at the offices, all the phones are answered. Everything comes directly to the office, and everybody there is just focused on sedation. So we can answer your questions. We can spend the time with you. We can really focus on learning more about the patient, their condition, and how we can help, which is really the main thing for everybody. So,
well, Dr. Vince, I appreciate you and your time. I know you've got patients to serve, so we'll let you get back to doing that. But appreciate the time, and we'll see you back here on the next one.
Definitely. Good to see you again.
Of course. And look, folks, we want to take a final moment, as we always do on this podcast, and thank you for making us a part of your day. If you enjoyed today's discussion, if you learned a thing or two, make sure you hit that subscribe button on whichever platform you checked us out on today, so that way you don't miss out on some other great conversations with some enlightening information about this next chapter for Dr. Vince and, of course, his team at Dental Sedation Centers. But look, for Dr. Vince, I'm Ryan. We're going to go ahead and say so long, but we appreciate each and every one of you stopping by and being with us today on Calm in the Chair.